Hi, everybody. My name is Amer Zeidan. I'm a professor of medicine at the Yale University and the chief of the Hematologic Malignancies Division. I'm speaking to you today from San Diego, where I'm presenting the American Society of Hematology annual meeting. And the meeting is seeing a lot of important advances being discussed both in myelodysplastic syndromes as well as acute myeloid leukemia. So there has been a number of abstracts that were presented on behalf of the authors from the COMMANDS trial. So the COMMANDS trial was the first trial conducted in patients with lower risk MDS in the frontline setting who were transfusion dependent and anemic, in which Luspatercept was given in one arm and the other randomized arm had erythropoiesis stimulating agent. And this trial has been previously presented and published and actually led to the approval of Luspatercept in the frontline setting in patients who are anemic, and in the USA label in patients who may need blood transfusions, as well as in Europe the label was more restricted to patients who meet transfusion dependency. So the clinical trial is still ongoing. Patients are still being followed. In this meeting, there was a number of updates focusing on the durability of the responses in terms of long-term responders and how many patients remained transfusion independent. So we know from the original presentation that the median duration of response for patients on the Luspatercept arm was around 2.5 years. So this is quite a substantial period of time with transfusion independence. The abstracts this year kind of took this one step further and looked at patients who achieved transfusion independency for 1.5 years or longer, looked at the percentage of those patients as well as the predictors. So some of the predictors were along the lines of what we already knew, such as having ring sideroblast and having low EPO level. But I think what we are clearly seeing from this data that a good number of patients achieve transfusion dependency for extended periods of time. We also saw some data being presented regarding the hemoglobin rise and how the quality of life of patients correlate when the hemoglobin goes above 10. So I think the totality of the data clearly suggests that starting Luspatercept as the first line agent for patients with anemia with lower risk MDS is, I think, clearly the standard of care right now, clearly in patients who are RS positive. In patients who are RS negative, I think this is something still being discussed, but when you look at the data together, I think it's also very reasonable to start it in patients who are RS negative. Other updates were looking at the safety, the rate of progression to acute myeloid leukemia, high risk MDS, as well as adverse events, and there were no concerning kind of new data there. So I think overall supporting the main findings from the original trial.